Hello, everybody. Welcome back to another episode of the Rehab with Roni podcast. Before I get started on today's question and answer session, I just want to say thank you to everybody who listens. I don't know. I'm just feeling very thankful right now for the ability to create content online and push things out. And the podcast is just something new that I decided to do in 2025. And I don't know. I really appreciate those of you who listen and say nice things about it online and give it 5 stars and say nice little comments. It's a fun alternative content form for me. I created the podcast for several reasons now that I think about it. First off, to be a resource for people that are interested in my journey, whether that be PT specific, business specific, pregnancy, whatever I'm up to. Number 2, to get connected with like-minded people and have good conversations. And honestly, number 3, to work on my public speaking skills because as much as I may seem confident online and talking in stories and even maybe on this podcast, historically, public speaking for me has been quite the obstacle I've learned to overcome. And I don't even think that this qualifies as public speaking, to be quite honest, because it's not public. I'm sitting up in my office alone. My dog is watching me from the corner. So that's my audience. But it forces me to clarify my thinking and my speaking and hopefully become better at it overall. So just thank you to those of you who listen, and I will stop being emotional now and we can get into it. Every so often, I like to do these Q&A sessions for the followers, for people that are inquiring about things on the internet, because I get a lot of repeat questions or just fun individualized questions. And in an effort to stay more connected to you guys and feel like you're getting the responses from me that you desire, I like to do these little sessions. First one, thoughts on branding moves. If you grow, will you only hire PTs named Veronica? LOL JK, parentheses, kinda. So relevant. What a great question. I've gone back and forth on this since the conception of Rehab with Roni. When I incorporated myself as an LLC, I was like, is it really that smart to make the name of my company also my Instagram handle? In retrospect, no. I wish I had branded the actual physical therapy space something a little bit different that didn't have the with Ronnie in it because to this guy's point, what's the likelihood that I only find PTs? Yeah, I'm only going to put feelers out for PTs that are also named Ronnie, whether that be male or female. It has to stay Rehab with Ronnie, and therefore you must be named Ronnie. That's kind of silly. So I've thought about it a lot. I've thought about keeping it just because it is so original and just so OG, right? Like this is how we started. It was Rehab with Ronnie. But at the same time, if I expand to a larger location, I have multiple PTs under me. It could be a little odd to be like, I'm going to rehab with Ronnie. Oh, are you seeing Ronnie? No, I'm seeing Jessica. I don't know. So it would be wise for me to rebrand, but that just sounds like so much work. And right now it's working, but it's this looming dark cloud overhead. Don't you worry. I've considered it to great extent. I just have to put my boots on the ground and get working on that. So send me in what you guys think my company should be named, my physical location. I mean, I'm definitely going to keep my social medias all Rehab with Ronnie, podcast Rehab with Ronnie, but in person, what do we want to call it? Rehabilitation with Ronaldo. No, I'm just kidding. Something different, something that doesn't have any trace of my name in it at all. How will AI change how patients seek out in-person PT evaluations / treatment plans? What a good question. I think everybody wonders how AI will impact their workplace, no matter what you do. I think that in many, many ways, it's going to be this great tool that we have. I've already been able to reap some of the benefits of AI, as I've mentioned before, just with my documentation. And I mean, AI is a huge help for me in that realm, and I spend a lot less time on documentation now because of it. So it positively impacts the PT experience. But as far as how patients seek out in-person PT evaluations, I don't think it's going to change that much. Maybe I'm being too optimistic. Naval Ravikant has this quote, and he says, if you are an entrepreneur, you are not worried about AI taking your job. And I honestly think that that is so true. I've not once woken up and been worried of AI taking over Rehab with Ronnie and taking on my patients and giving them so much autonomy over what's going on with their body that they feel that they can just go through ChatGPT and not seek out the advice and in-person hands-on care of a real PT. I just don't feel like that will ever happen. And you don't even have to be an entrepreneur. I think like if you work in a regular clinic, humans love human connection and we love the hands-on and we want someone real to tell us what's going on. Do I think that things like ChatGPT could help guide patients in the right direction? Like maybe they enter in their symptoms and from there they have a better idea of what they think might be going on. Yes, but I still think at the end of the day, if they try things on their own, and I get a lot of patients that do that and it doesn't work, they're going to seek out your help. They want the professional's advice and they want to be treated in person more than anything. It's that physical one-on-one that is so special about physical therapy. So AI is not coming for us. I don't think so. I feel like I can pull this clip 2 years from now and we're all virtual and I'm like, "Hee sorry guys, I was wrong." But for now, that's my stance. Next question. How did you do it? Exclamation mark, exclamation mark. How did you grow? Double exclamation mark. Okay. Grow social media wise, grow business wise? Question mark. That's my question back to you. But I guess I'll answer it in two parts. And honestly, you can go back and listen. I believe I've made episodes on my social media strategies and then also kind of how I got my clinic started and the trajectory of that and what that's looked like over the past 2 years. So definitely go and reference those episodes, but in short, I I don't take a lot of credit for the content growth. I don't really freaking know, if I'm being honest. I feel like there are a lot of PTs out there that put out really good content and don't see a lot of growth, and I don't know why the algorithm favored me in this special way in early 2024. I'm so thankful for it, and I do think that I can, you know, credit myself a little bit to the consistency that I put into the content, the clarity, the personality that I let shine through. All of that has been consistent and I like doing it. And so I think when you like creating content, there is just an air about it that makes it easier to do and people enjoy following. I don't have a secret code though. I'm not like, okay, guys, on Tuesdays at 2 p.m., post a how to video. And then Wednesday morning, post the. I don't know. And I'm actually really working on developing a content calendar because I don't have that right now. I just kind of go willy nilly and whatever I want to do, I do. And I think that's silly. I think I could probably feel a little less chaotic inside my brain if I had more of a plan. So that's on social media. And on the business side of things, just chug along. I've said this before and I'll say it again. When I quit my full-time PT job, my corporate job said you can either stay here and stop doing your side gig at the gym, or you can stay at the gym, but you have to leave here. There's really no other option. And that first week that I was flying solo, I had one singular patient on my schedule, and that was April 1st of 2024. So I just simply chugged along and just kept working and just kept working. Consistency is such a boring answer, but not giving up and not getting discouraged, which is super easy to get discouraged when you're in the thick of it and you feel like no one knows who you are and no one's going to come see you. But I just continued. I kept on keeping on. Super boring answer, but go back and listen to the episode about how I started my business because I know I go into more detail about it there. Next question. I'm thinking of taking a dry needling course. Do you use it a lot in the clinic? I do. Here's my advice. I remember when I graduated PT school, one of the first continuing ed courses I signed up for was a dry needling course. And one of my mentors at the time was like, no, you're not ready. So to that, I tip my hat off because I agree. I don't think I was ready. I think when I was fresh out of school, I just hadn't seen enough patients, hadn't done enough hands-on experience to even know when dry needling would be appropriate or not. So I waited a year, a little over a year before I took level 1, and then I got level 2 certified a year after that. So do I use it a lot in the clinic? Yes. I love it. Patients love it 95% of the time. And I think it's a great tool to have. It's a great manual intervention, and it can just be really helpful. I always say to my patients, like, these needles can go deeper than my hands can. So if there is a trigger point or a latent trigger point or something going on within the muscle that can't maybe be addressed as efficiently with my hands, the needling is such a cool thing to offer, and people really tend to like it. Like I said, 95% of the time. There will always be those 1 or 2 people that are like, "Don't touch me with that needle." I'm like, "Respect. I'm not gonna force you." But I think it's great, and I think that as long as you feel ready, you should take the course. What do you do when you are stuck on a specific case and are not sure what to do next? This is a solid question, and this hits home for me because right now I am dealing with something like that. And it's tough. It's tougher when it's all on you and you're the face of the business and it's Rehab with Ronnie and you're the PT. And I mean, now I have an employee, but you feel so personally responsible for people's recovery and you do your darndest. But sometimes, on rare occasions, there are those people that just don't seem to be responding well. And you've tried other avenues, you've worked on surrounding body parts, you've really trial and errored a lot of things, and it's just not working. And it's tough. So what do I do? I'm honest with the patient. I explain the rationale for why we're working on what we're working on. My expectations for recovery and kind of like what I want to happen versus maybe we're not where we want to be right now. And I'm just honest about it. I'm not going to pretend like, okay, like this is fine. This is totally normal. And I will start to look at the full picture maybe a little bit more. So if someone is not progressing the way that I would expect them to, and they've already been to the doctor and they have the imaging and we kind of know what's going on, I will start to look more into lifestyle factors. So what is your stress level? How much water are you drinking a day? What is your sleep looking like? Addressing it from a more holistic standpoint. And that is something that I tend to do regardless, but if it's someone who just seems like they're just aggravated and they're not responding well, that I recognize that there is something else at play. And although physical therapy is great, it is not the end all be all. So I also am aware that maybe PT isn't going to be the perfect thing for them at this time. So I just have to level with myself, and it's you have to not let your ego get in the way because I do think that as PTs we like to think that we can fix it all. So it doesn't happen super often, but when it does, you have to almost zoom out a little bit and try and see what else might be going on, what could be contributing to this. Are there any other specialists that I know in the area that might be able to be of service to them where maybe I'm not as well versed in that area? Just recently, I had a woman who she's got some shoulder stuff going on, but she has mentioned multiple times different hormonal changes that have happened. And I luckily know, I wouldn't want to say holistic medicine doctor, but someone that does hormone testing and blood tests. And I referred her there because I was like, look, I don't know that much about that. I'm not going to pretend to, but I think it might be helpful to just check it out. So be connected with other providers and think critically and don't let your ego get in the way. How physical do you find your job? Does it ever get tiring? Yes and no. Funny enough, I was just having this conversation with my husband last night. We were laying there and he was like, who's holding my hand, sweet, tender moment. And he was like, do you remember when you would come home from your corporate PT job those weeks and your hands would be in so much pain? He would make me get in the cold plunge and stick my hands in there and they would like cramp up and seize and these muscles would twitch. I just had like the worst hand pain. And I think I could definitely attribute that to the fact that I probably didn't have the best body mechanics and I was using my hands too much. So that's on me. Shame on you, past Ronnie. But gosh, I remember it feeling quite physical. And that is certainly related to just sheer volume of patients that you're seeing. If you're seeing 5 times as many as you are in a cash-based clinic, yeah, you're going to be more tired. It is more physical. So switching over to my private practice where I'm seeing people one-on-one, like max 7 or 8 patients a day, more so like 4, 5, it's much less physically demanding. However, now that I am, gosh, what will I be? 35 weeks pregnant? I'm still getting up and down from the ground, but I am it's interesting. I can feel myself slowing down. Like, I try and get up from the ground, and instead of just popping up, I'm using my hands or I'm holding on to stuff, and I'm like, "This is funny." It's a it's an interesting change to see. Or you're like, I'll quickly lay on my back to show something, and then I try and get up, and I'm so dizzy. I'm like, "Huh, interesting. I don't remember feeling this way." But it's my first time pregnant, so I'm not used to the physical changes yet. But it's all good. Okay, next question. Why did you choose ortho setting and not peds? I actually never did a pediatric rotation. I, for some reason, have no interest in working with children. 0. Like, negative interest, I think. I remember working in my old job, I think the youngest kid I ever had was 12, and I was like, "Yeah, this is my cap. I don't wanna treat anybody younger than this. It's just not for me." I don't know. Love kids if they're my nieces or my friends' kids or one day my kid, but I just wasn't interested in treating that's just it. I was always interested in the sports rehab side of things. At one point, I thought I wanted to do dance PT because my background is in dance, and yeah, always wanted to work with adults, have adult conversations, have them reciprocate and be able to understand what I'm saying and apply it to their life and not have to talk to a kid all day. I couldn't do it. And hats off, kudos to those of you who do it. Obviously, you have different qualities and a different mindset when it comes to working with children. I just simply cannot do it. Oh, this one's not a question, but just such a sweet little note. Loads of love, heart emoji, and best wishes from India. Wishing you the best and more power for your delivery, and you are doing great. Great is spelled GR8. Okay, kind of a weird side note. It's not even weird. It's just interesting to me. My top listeners and top followers on Instagram and on this podcast, it goes like United States, Canada, UK, Australia, and then India. India is they are Rehab with Ronnie supporters. And I know that that's also just like a very large population. What are there? Probably a billion people that live in India. Actually, let's look this up. Okay, guys, I was not too far off. In 2024, population was 1.4 billion. So it makes sense that there would be, I guess, a bigger following, but people from India love my content on Instagram, and I really love them for that. So thank you to who wrote this in. Makes me feel so loved. Did you always know you wanted to go into PT? Yes and no. I always knew that I was allergic to a desk job and allergic to staring at a computer all day and being alone. I love the idea of helping people and having a organic human connection where I'm guiding somebody to recovery. I just think that that's such a cool job to have to make an impact on people's lives in whatever small way that I can. PT just seemed like the right path for that. And although I had never been to PT myself, now I have. But in the past, when I chose this career path, I hadn't. I just was drawn to it. And then when I was doing my observation hours, I was even more drawn to it. I was at Grady Hospital in Atlanta. I was at Emory. I was doing these hours and I was thinking to myself, this is it for me. Thank goodness I chose this major. I never changed it. I stayed the course. Super thankful for it. I don't honestly know what I would be doing otherwise. Can I do my clinical with you? Hard eyes, hard eyes, hard eyes, bunch of exclamation marks. Girl, yes, you sure can. I have a student coming in the spring of next year. I had a student come for an elective for a couple of weeks this past spring. I'm all about having the students. I think it's great. All you have to do, I think logistically, is make sure that I am a registered clinical site through your school and your director of clinical education has approved it. The local school here, UTC, University of Tennessee at Chattanooga, now I'm a registered site. So people can come and do their rotations with me, which is so cool. I love educating people, obviously. I mean, part of the reason that I create all the content that I do and have this podcast is to just spread the love and spread the knowledge and also to learn from the students. So come on over. Let's hang out. Have you had any injuries slash pain you have overcome? Mm. I just I just mentioned how I had never been to PT prior to going to PT school. However, since then, yes, I self-diagnosed myself with a right hip labral tear. She is still present for sure. I have never undergone surgery for it. I think it came honestly from years of dancing. So in dance, you have a stance leg that's dominant. Mine is my left. And then right leg is often involved in like going up overhead. You grab it, you lift it overhead, you twirl. And I think lots of like forced external rotation, flexion, abduction to the maximal amount on that right hip caused some damage. And then it wasn't until I started working full time, sitting a lot more, and then being more focused on weightlifting that I noticed it. But gosh darn, I have rehabbed that thing back to its dormancy. I haven't seen it in a while. She hasn't yelled at me in a while. So I'm really thankful for that. And then in pregnancy, for sure, it's been very interesting. I have a whole new level of understanding and respect for new moms and pregnant people. You know how it is when you're a PT and someone explains symptoms and you kind of feel you can empathize. You can picture, even if you've never had it yourself, you know what they're talking about. But now going through it and being 35 weeks in, I really feel their pain. And I've had some severe pain. I've had some serious SI joint issues, but then they go away. And then I had some really bad pelvic pain and I stopped doing Pilates. And for the most part, it's gone away. And so pregnancy is super interesting because things feel very fluid and very transient and not sticking around for a while. I'll be curious to see how I recover and how I feel postpartum, but every injury that I have, every tweak, every uncomfortable situation I find myself in while pregnant, I'm just kind of like, it will pass. This too shall pass. So I don't overthink it too much. But yeah, pregnancy stuff, hip stuff, I think that's it. Is it hard to start your own PT studio? Depends on your definition of hard. Anything worth doing is going to be hard, right? Right? Uh, it wasn't easy. I wouldn't look back and say, "Oh gosh, yeah, what a breeze. Everyone should do it. I don't know why they haven't." It depends on your capacity for hard work and what you can tolerate and what you're willing to put in. It's worth it, 112%. But of course it was hard. But if it wasn't hard, how rewarding would it really be? And how successful would it really be? I don't know. Hard is an interesting word to use to describe it. It is plenty of hard work, but at no point did I sit down and just go, oh, this is just too hard. If you like working hard and you're motivated to be self employed and have ownership over your time and your life, hell yeah, work hard. It will be fun and it will be worth it. What are your favorite parts about living in Tennessee? Oh, I love Tennessee, you guys. I was raised in Georgia, only 2 hours away from here, but I specifically love Chattanooga so much. Favorite parts? Hmm, so many. The outdoors. They call it the scenic city. I'm pretty sure they call it the scenic city. It's a scenic city because we have the bridges, we have the water, we have the mountains, we have a cute little downtown area. I mean, it's just scenic, number 1. 2, we have great restaurants. I just feel like people, when they come to town and visit and I take them out to like my favorite spots, they're always a little taken aback. Like, who knew Chattanooga had such a pop and culinary scene? We have really, really good restaurants. And I love the people. I think being a small business and getting to know other small business owners and just getting connected in this relatively small town. I think Chattanooga only has like 250,000 people, which kind of sounds like a big number, but when you think about the spread, it's a small town. You see a lot of people you know. It's good vibes over here, honestly. And I love being close to my family. My in-laws live here now, and my family's not too far away in Atlanta. And I don't know. I freaking love it. Okay. It's the only downside is I developed allergies once I moved here. I don't know what that's about, but it's a great place to live. All right. Last question. We'll wrap it up here. What is the first step for someone wanting to go the cash pay / solo route? I love this question because I am trying to think back on what my first step was. And there's so many first steps that you could take. But I would say, most importantly, just find somebody who is doing what you're doing and talk to them. And that person could honestly be me. Like, hey, girl, reach out to me, send me a DM. But I had a mentor. I mean, we still keep in touch pretty frequently. I've actually had him on the podcast, Bobby Hines. and he was doing what I wanted to do. He lives about 3 hours away. We went to the same PT school, so I felt very connected. I felt like this was approachable and doable because I knew him, because we had similar backgrounds, and having that connection and that touch point and that person to ask questions and kinda guide you is a great first step. And honestly, when I first started talking to him, I didn't even know, I was kind of on the fence. I was like, what should I do? Where should I go with this? I have some people that wanna see me on the side. What's the next step?" I would say that, like, finding someone to chat to and then finding your niche. And I wouldn't have said that like a year ago, but you can't just treat everybody. You have to be the person in town that people go to for X. So, those are my little tidbits of advice. I really like these Q&A questions, guys. I think I'm gonna do more of them. As previously mentioned, I am trying to no, I will release 1 episode per week for a year straight. And so we're almost halfway through. I'm pretty proud of myself. I'm really interested to see what this will look like postpartum when I'm sleep deprived and trying to keep a little baby alive, but I'm going to do it. And these solo episodes where I do Q&A and just talk to you about the things that you're curious about are so fun. So, thank you guys so much for writing in. Write in other things that you think I should chat about on the podcast because I love doing it. And I think that closes it up. I'll see you guys next week.